Seconds worldwide, someone is told that they have some form of lymphoma. According to a global patient survey done by the Lymphoma Coalition, 62% of lymphoma patients are not diagnosed immediately. The National Cancer Registry lists lymphoma as the 8th most common cancer in South Africa, and non-Hodgkin's lymphoma is rated the 7th most common cancer in both men and women in the country. Now, to talk to us more about World Lymphoma Awareness Day, we're now joined by Dr. Devon Moodley, a medical oncologist at the Donald Gordon Medical Center in Johannesburg. He's also Director of Campaigning for Cancer. Doctor, a very good morning to you and welcome.
Good morning.
Firstly, tell me more about lymphoma to educate us all.
It's an interesting disease insofar as it is a cancer of your blood system. So the primary cell affected is a lymphocyte, and it affects the lymph organs, what you would commonly refer to as nodes or glands. Okay? The two biggest ones in the body are the liver and spleen, so those glands may also be enlarged. Okay? So it's actually a cancerous infiltration of that group of organ system. Okay? And when it does that, it can affect your blood. And when it does that, it drops your immunity, and so you are predisposed to infections.
I see.
So you have patients presenting, as a rule, with lumps or bumps in the neck, in the armpits, in the groin, even at some parts of your body, little nodes, okay? And they get bigger. They may also present outside those nodes, and when it does that, it's called an extranodal spread, okay? And when it does that, then what happens is you have a condition called lymphoma, which is a blood cancer.
But that's only when it's visible.
Yes.
But if it's not visible, it's very, very difficult to detect.
Well, it's visible when it's huge and you can see it. You can still feel it. You know, you shouldn't be able to feel huge bumps under your skin, and certainly not hard bumps. The big problem with these glands is that they're usually painless, right? And when things are painless, we don't seek help. We'll say, it'll go away. So we leave it alone, okay? And they just grow and grow and grow.
Yes.
And that's your big problem. And that's why the statistic that says the majority of patients don't get diagnosed early, because as a rule, we're willing to ignore things so that they go away.
So if it's a limp that you can't feel, there's no pain to it, for instance, in your neck that's maybe bulging, should you be concerned?
I think every bump that is unusual, that protrudes, that's sitting there, that doesn't go away, needs to be investigated, okay? Especially not only because it may be lymphoma, it may be other also very treatable things. TB can give it to you. Other infections can give that to you. So I don't think it's something you should ignore. I think it's something you should look at and get checked out.
So you said investigated. How do you investigate it? Do you go to your doctor?
Your doctor's a very good place to start, okay? What needs to be done in order to make the diagnosis of a lymphoma is you need a biopsy. And what that means is a piece of that gland, okay? And that usually means a little bit of an anesthetic and taking a piece. It may or may not be in theater. It's not a big operation, okay? And that piece that they take, which is that big, gets sent to the laboratory. The laboratory does a panel of tests and comes up with a diagnosis of lymphoma.
Can it be treated?
Yes. Lymphoma can be treated in many, many ways, okay? Sometimes all you need is radiation. Sometimes you need chemotherapy. Sometimes you need a monoclonal antibody. Sometimes you just need pills. And there are some cases where we actually just watch and wait, and we don't even treat them until they get to the point where treatment is needed, okay? So it's not something that says you have to be treated, and neither is something that says it is too far.
What can medical practitioners do to detect lymphoma earlier?
Well, I think education is the cornerstone of early detection. And basically, patients need to be educated that if there are lumps or bumps anyway, get it checked out. And if you're not sure, get a biopsy.
Now, it is World Lymphoma Awareness Day today.
That it is.
What can people do, or is there any events that's happening?
There are lots of things going on today. There's World Lymphoma. It's got programs all over the place. And If you want to know what's happening, Campaigning for Cancer has a website at C4C, Campaigning for Cancer. You can check it out, and you can check out all the things that they have planned for today and indeed for the rest of the week.
Give us that website, Doctor.
It's Campaigning for Cancer.
Campaigning for Cancer.
Yeah.
And for people that want to know more, they can also go to
They
the website?
can go to the website, or they can even get hold of us at the Donald Gordon Medical Center, and we're happy to walk you through the process.
And what sort of information will they find on the website? If they...
Well, you will find things about early diagnosis. You will find things like other people that are so-called celebrities that have also had this disease. They'll find things about treatment. They'll find things about what you should look for. And, it demystifies the whole process.
Is it better to have early detection and be treated, or to just, some people would just leave it?
Okay. It is always better to know what you're dealing with, and it's always better to treat something early than to try and treat something when it's advanced.
Doctor, once again, thank you so much
Thank you very much,
coming
sir.
into the studio.
Thank you.
That was Dr. Devon Moodley, a medical oncologist at the Donald Gordon Medical Center in Johannesburg.